How are you doing?
I'm good, thank you. So I was just introducing your name a little bit. I don't know if you want to introduce yourself more because you can probably do it better than me with today's live and what we're going to be talking about.
Okay, I'm Melissa Petty. I'm a licensed professional counselor, and I am in Virginia, so different than Jackie, who's in Minnesota. And I am Body and Mindfully Healthy online. That's my IG handle, and that's the name of my private practice. It's a solo private practice currently, and I mainly specialize in EMDR and CBT, work with a lot of anxiety, depression, anger, PTSD. And I really reached out to Jackie because I was like, I'm not really into, like, I'm not a sex therapist, and I just noticed that there's a lot of times when sex actually comes up in counseling, whether it's with depression or trauma or anxiety, like it is something that's brought up in therapy. So I was like, "Ah, I would love to just have a conversation with Jackie and talk more about the intersection between sex and mental health and our bodies because it's all interconnected, and I'm so thankful to be here. And I just want to say also that I'm just so thankful to know you and have met you over Instagram because I feel so much more like community and support from you and some other therapists on here, and I just really appreciate that.
My heart. Thank you, because I feel the same exact way about you too. And I'm gonna get emotional. I haven't had my good cry this week, so it's gonna happen today. But thank you for saying that, because I feel exactly the same way about you and building this community on Instagram and opening up the conversation about not only sex but mental health and all the different things and the wonderful things that you post too on your page as well. For the peeps out there that may not know what like EMDR and CBT is, can you just kind of share that? Because I know you and I are therapists, we know that lingo, right? But maybe some of the people live are like, "What the fuck, Jackie?" Like, I don't know what that means a little bit. Would you be able to just share what that means a little bit
Yeah,
more?
so CBT is cognitive behavioral therapy, and that's just like traditional talk therapy that a lot of people imagine when they come in for a therapy appointment. It's talking about your thoughts and feelings and behaviors and how those all intersect and combine and work together. CBT really focuses on how you can change your thoughts, and changing your thoughts can help you to feel differently and then do differently. And EMDR is not like traditional talk therapy. EMDR stands for eye movement desensitization and reprocessing, and it's traditionally used for trauma. However, there's been more research that has shown to be effective with depression and anxiety, obsessive compulsive disorder, substance abuse, a lot of different things. So it's really exciting, and it's using eye movements, the same movements that you have in REM sleep when you're dreaming, to help your brain reprocess and think differently than it had before. So it's really, really fascinating and it's amazing.
Oh, I actually didn't know that part. Learn something new every day. I'm glad I asked that question. Thank you for sharing that with everybody that's tuning in a little bit. So I will just introduce myself. I'm Jackie, she, her. Like Melissa said, I'm in Minnesota. I say y'all, so no, I'm not from Texas, but it's more inclusive. So YOLO, just going to use that word throughout today's live. Essentially, I'm a sex therapist and mental health counselor. I love working with clients who are very, very sassy, go, 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 motivated like me. They don't mind some cussing like the fuck word in session or some big bombs out there. That's my jam. Those are my clients. Those are my peeps. And if you're ready to do work, that's the type of client for me. So I really do a lot of sex therapy, work with the LGBTQ plus community, trans and gender expansive community as well. And I focus quite a bit on self-worth, anxiety, deservability, and do a lot of different things within my niches. So yeah, that's a little bit about me. Can you share a little bit about like your ideal clients and the people that you work with a little bit more that are like really your jam, like we're just vibing, we're good together, and this is a good match?
I love working with everybody, honestly. Like I love it, especially now with telehealth being like so expansive. Before COVID, like I really didn't feel comfortable with telehealth, and now like I've had a year of experience with it because we were all forced to have a year of experience with it. And so I love my in-person sessions where it's local folks in Southwest Virginia, but I also have a lot of clientele with telehealth throughout the state of Virginia, and it's just so wonderful to have like such unique and diverse clientele that it's like a breath of fresh air, honestly. And and I just love working with the folks I work with. And I always tell people that, it doesn't matter, like, because I don't know if you get this, maybe you don't, but I'll get people in therapy and they'll be like, they'll say a cuss word, and then they'll be like, "Oh my gosh, I shouldn't have said that." I'm like, "No, no, no. You can cuss in therapy. Like it's okay. Like if that's what you normally say, like this is a free and open like space for you to be who you are, and it's completely okay. As long as you're not swearing at me, like we're good." Swearing at me is not appropriate. It's disrespectful, right? Like we don't like that. It doesn't feel good. So I usually have to like clarify that for folks too. But honestly, usually like working with people with lots of anxiety, working with people with trauma, working with people with depression. Really love working with those populations, but really everyone's so unique and different. Like it's hard for me to be like, this is my specific person that's my jam because I just love getting to know the individual and knowing like all their different personality characteristics and their life history and like helping them to kind of navigate and figure out like what's kind of causing their symptoms and what they've already tried before and how this can be different, because I don't know if you ask that too when people come to therapy, have they been in therapy before and what worked and what didn't work. And I always tell people that I just want to make sure that if you're working with me, like I'm not going to do something that didn't work before because it didn't work, right? So let's not do it again and make it be traumatic and feel bad or shaming. Like let's do something different to make it work this time.
Mhm. Yeah, absolutely, totally. And like a fuck you, Jackie is different than like fuck my life, like in session for sure. Like going back to the swearing thing, yep. And
Yes.
also that's totally a part of it. Like if something's broken in therapy, then like we gotta fix it and we gotta do something different. And that's totally an important conversation for us to talk about with clients, like not only throughout the therapeutic like process and experience, but also at that beginning like initial consult or intake, and just kind of breaking things down a little bit to understand a little bit more of like what's really going to help them and like how can we do something different this time that is going to be more therapeutic, and that person feels safe to cuss in your office or just even come back to that next session, right? Because sometimes that can even be the scariest thing, is putting yourself out there and seeing a therapist for the first time ever, even like the fourth or fifth, however many times. It could always be just as equally scary, but it could also be as equally, or if not more healing, if we're having that conversation like you described. Absolutely. Hmm. And
So, oh, I'm sorry, go ahead.
no, you go ahead.
So I was gonna say, how long have you been doing sex therapy specifically?
Yeah, so I have been working as a sex therapist. Oh my goodness. I have to look at what year it is. But it hasn't been like 10 plus years or anything like that. No, it's been like almost, it'll be from November 2018 till now. So, however long that is, I'm not a math person. So, almost 3 years, I guess I would say. I definitely had learned a lot of different things about different types of mental health diagnoses where I previously worked, and done a lot of different types of therapy. But like I always knew that this is what I wanted to do prior to grad school. And that's really why I got all my training done and got my coursework done to be able to do this work, because I just love it so much. And I think it's super important. And it's interesting how you're saying, like with cognitive behavioral therapy, it's like the intersection of like your thoughts, your feelings, your beliefs, and like all these different things. And literally, like, that's a little bit of sex therapy at times too. Like, it is that integration and intersectionality of what we're going to talk about today, like the body, the mind, like, right, all these different things, mental health, that is just so important to discuss with our clients. So yeah, a lot of different things. Did I answer your question? I went off on a tangent. I always do that.
Yes, you did. Yes. So, so my like I don't have a huge extensive knowledge of sex therapy. So like tell me about like the types of different sex therapy because I think we talked a little bit before and but I wanted to like kind of hear the whole list.
Oh my goodness. Okay, how much time we got? No, I'm just kidding. So sex therapy. So literally, like it could be treatment of erectile functioning. It could be premature ejaculation. It could be genital pelvic pain. It could be orgasm. It could be like anything in that little big blue DSM book that we have in there, right? Any of those like sexual functioning, like diagnoses or symptoms, that is what is typically known as like traditional sex therapy. Obviously, like that book was written, I think maybe almost 10 years ago now, maybe a little less or maybe a little more. And so now really a lot of what my training has been in assessment and treatment for that also. But that could also mean so many different things. I work with folks that want to explore their sexuality that may not feel like I'm so vanilla with sexuality. I'm really like more kinky. So I love working with BDSM kink clients, folks. Literally, I see anxiety quite a bit with sex and sexuality because some people might be like, Jackie, I really want to tell my partner what I want in bed or in the kitchen or in the living room or whatever, wherever we're having sex, but I don't know how to communicate that with them and I'm really nervous. So it could even be that piece of it, like learning how to talk to your partners about sex, sexuality, spicing things up, changing things. It could also be working with the LGBTQ plus population and trans and gender expansive folks. So really exploring like romantic attraction, sexual attraction, emotional attraction, and really breaking down all these different levels of intimacy too. And with trans and gender expansive, like gender identity and focusing in on what that means for the person because every person's experience is different of their gender and sexuality and gender can be fluid. So it's even talking about conversations with that with sexual fluidity. So a lot of my training has also been in diversity, like gender diversity, which I just find super fascinating and I love that work too. I'm trying to think if I missed anything. It could be sex later on in life because again, like that doesn't necessarily get acknowledged that much. Like when folks maybe in their 70s, 80s are going to the doctors aren't talking to them about sex. Nurses aren't talking to them about sex. I've worked with folks that are sex and late life couples and it's kind of like, well, I've lost the desire or desire discrepancies are different. That's the biggest reason that people really seek help for sex therapy as well. So there's so many different things and it's so much fun to just be able to like learn and listen to like what people really want to explore. It could also be polyamory and open relationships and different types of relationships as well too. Sex and technology. It could be out of control sexual behaviors, which is formerly known as sexual addiction. I don't use that word because I don't want to be sexually shaming in any way. Like my whole thing is to be shameless and like you do you and let's like take those shameful messages that maybe from like your childhood or those early developmental years and you know what, let's focus on like you and not have that shame that was put on like to you in your lifetime like run the rest of your life and keep you from who you are as a person, your sexuality, whatever. And how mental health can definitely tie into that is just like that guilt, that anxiety, that depression attached to it, and feeling like you can't go to anybody about these things. So there's a
Like
lot.
especially because of sex being such a like a taboo topic to begin with. Like it's not
Totally.
openly talked about in society as much as it's like sold in society, right? Like it's sold more than it's actually talked about and like educated and going beyond just like selling it and talking about it and like going deeper. Like what are the feelings connected to it? Like how does your body feel? Like what's normal, what's abnormal? You know, what are people's preferences? Like that's I think that there's a whole like arena of things to talk about
Mm-hmm.
that really aren't talked about in our society.
Mm-hmm, totally. And the part about the body, like you were saying too, just even noticing like pleasurable touch. Where is that on your body? And like slowing that down. Can you describe that touch? Does it feel like there's a lot of pressure to it? Is it really soft? Is there a certain motion that goes with it, right? Is there some sort of like texture that it feels like? Is there some sort of fabric? Like all these different things. And I think that's super important to know about like sexual pleasure. That's so important, like to know what that consensual touch from another person or just even like touch for self to give that to yourself and to know what feels pleasing and satisfying is super important too. Absolutely.
And I love how you threw there consensual, because I think consent underlines all of that therapy,
Yeah.
the
Yeah.
therapeutic process, and then what is talked to, like what their actual preference is, what they feel is natural. Consent underlies all of it, whether it's, changes in from a monogamous relationship to polyamorous or like talk more about that consent because I think that's so important.
Yeah, so you made me think about like I love doing I wish that all of us growing up somehow some way in the future or like in the past like if we were to go back and think of ourselves at like a teenager or early adolescence or even younger and think about like our sex, sexuality, attraction, breaking those things down. I wish we all had a way to do an exercise like that. And that's what I love about BDSM and kink specifically, because there's so many negative stereotypes and myths out there about what it actually is. And it's like, no, BDSM and kink is really based around consent and like saying no, saying yes, and saying maybe. And so that's what I love with when I'm really doing a lot of work with my couples or even individuals, right, that just want to explore their sexuality. Maybe they're not partnered and they want to know, like, this is what I'm into, this is what I'm not, and this is a maybe. I love using BDSM and kink checklists because, right, like that is a documented form, a version that we're talking through in session. You know what is consensual, what is not consensual. And even though we're discussing it in that one session, right, like I don't see my clients have sex, right? Like I'm not in the room with them. Like they need to continue that conversation together and to ask and check in, has anything changed? Because consent is not a one-time thing. Like an example could be like, okay, I did this BDSM checklist with my partner today and I really want to be like tied up and next time we have sex. That's what I want to do. I want you to use this toy on me. I want you to do this pressure. I don't want to be blindfolded. I want to wear this outfit. I want you to act out this scene, right? Like I may want that right now, but the next time we have sex, that could be a whole nother different day, a different week, whatever. And I could be like, fuck no, I don't want that. Like I've had a motherfucking day. I'm tired. I'm crabby. Actually, like I'm on my period, yo. Like I'm not doing this, sweetie. Right? So things could change. Like stress could change. Consent could change. And that's one example of it, right? Another example could be like, okay, no, well, I'm actually not really interested in that right now. I would rather just us be able to kiss and make out for a while and see where that goes and just slow down things and have no pressure be put on sex. And so I think there's definitely an important part where we always have to go back to consent and what's consensual and even check in the moments. Like if you are having sex with your partner, asking like, hey, should I grab this toy? Or hey, can I tie you up? Or hey, can we try this? It doesn't have to be this whole like pressured thing. Like when we do it in the moment, that could be something that is actually more exciting and opens up our sexuality and allows us to explore more. So consent isn't a one-time thing and things can change like out of nowhere depending on the day or the week too. So I think with folks out there that may be listening to this or tuning in later, just always check in on like what is consensual with your partner and what's not. And to even reuse those BDSM and kink checklists or just even checklists where it's kind of like the yes, no, maybes and going through them and like reiterating it over and over and over again. And sometimes people might be like, well, they said this at this point in time, but now they're saying this at this point in time. I don't get it. And so sometimes that's when I really come in and they might need my help because sexuality changes and it's fluid. Same thing, like you said, polyamory, like, okay, if I don't have something that's in my partnered relationship, right? And I need to seek outside of the relationship for something sexual that my partner just can't fulfill, whatever that be, whatever that need might be, right? Or that sexual satisfaction or pleasure. Can we have a conversation about an open relationship and someone, maybe it's just one person or whoever, or maybe it's more depending on what that might be. Like, is that something we can talk about and create a contract around, right? That is written. And we go back to that. Like we have this written. Have things changed? Do we need to redo stuff? And it's not about having to redo stuff over and over again, but it's about having these clear conversations about communication with consent to make sure that like this is working for us. And if something's not working, talk about it before breaking that consent because that's just going to be even worse at the end of the day, right? So consent is not a one-time conversation.
And in consent also, the person can't be under the influence when they agree. It's like they have to be clear-headed. It has to be ahead of time. It has to be understandable so they know exactly what they're agreeing to and not no surprises. That's the whole point of consent, right?
Absolutely, absolutely. A lot of people will say like, well, that person was under the influence and they agreed to having sex with me, so it must have been okay. It's like, no, that's actually assault. Like, can't do that. And there's some people out there that might say like, well, no, that's not because I wanted it, they wanted it, we were caught up in the moment, whatever. And it's kind of like, okay, this is still something where this is like non-consensual. That's just what it is. And I think that's one of the things where a lot of the times people get wrapped around that a little bit. And it's kind of like this this weird, awkward, like gray area of feeling stuck. And I think that's an area where conversations like these and more and more and more in the future just need to continue because it's super important. And I was thinking about in the past when I did a speaking event about how like if this was for college students, like if we're in a group of people and one person you can see like someone is being too touchy feely with this person and this other person doesn't want that or isn't consenting to that and we don't feel comfortable to just flat out say it, what do we do? And I was just like, okay, well, there's some language that you can do around that. Me, I would be like, fuck it, like I'm going to grab that person and be like, peace, we're leaving them out, bye. Other people, you know, they don't have that personality where they may not just jump in and do that. And so they might just kind of say like, hey, like, will you go to the bathroom with me? Like, hey, let's go check on this person over here. Hey, let's go divert and do this distraction sort of thing. And it's even sad that we have to do that a little bit in a way to get away from these types of situations. But sometimes when it comes to safety and those types of concerns, that could be what's going to work. And that's what could be most important too. So yeah, consent is something that is just so important every single time. Every single time.
Definitely, definitely. And I think you had said before that you do some premarital counseling too, so people can have these conversations before they get married.
Yeah, literally. So I will do a lot of conversations around like sex, sexuality, open marriages, open relationships, especially because I've had folks and clients who come to see me when they've been married for so many years and then they want to open up. One partner wants to open up their marriage or relationship and the other one doesn't. So then it's like, well, I can't necessarily help you if you both aren't on the same page with this. So it's really to talk about it's also premarital counseling is also divorce prevention, right? Like a lot of people might say, well, that's really expensive. And it's like, divorce in the state of Minnesota, because I've been looking up those numbers lately, is anywhere from $3,000 to $10,000. And beyond that, if it doesn't get settled for years, it can be over $100,000. So yeah, is premarital counseling expensive? Of course, but you know what? So is divorce. So it's kind of like pick your poison at the end of the day. Like, do you want something that's going to be helping you and your marriage in the long run, or do you want something that like you may have never gone to couples therapy before or counseling before and like you're just not going to do it, even though you may have some concerns or doubts. And so I really ask quite a bit with my couples. When it's premarital, I ask them about polyamory, opening up. I ask them about infidelity. You know, like we're attracted to people, we're human, it's a part of our nature, right? What happens if there's an emotional affair going on? What happens if there's a sexual affair that happens, right? Do you feel like you can come back to therapy in the future and heal from this? Is that a deal breaker? And we talk about these things beforehand because then people know what are these deal breakers going to be, and then those lines are very, very clear too. So I'll incorporate a lot about sex, and some clients will laugh, and I'm like, no, these are really important questions to ask people too. And I think with some people too, they think sex therapy and couples therapy, they're exactly the same, and they aren't necessarily. Like there's so many forms of couples therapy, right? Like there's premarital counseling, there's marriage counseling, there's couples therapy where you might be in a partnered relationship there, or even partners. Like there could be multiple people in that. There could be infidelity therapy for couples. There could be retirement therapy for couples, like having to work on an adjustment or something like that. And so I think it's so important to just even talk about how like sex therapy and couples therapy are very different. Sometimes we have to do both of them together because if we're doing some exercises on like orgasm or whatever in session, right? Like and having this be a partnered activity, like I need your partner here. Like we got to do this work too. Like sometimes it may be individual, but it's also that couples dynamic and element because it's not like you're always having sex with yourself. Like you want to be connected with that other person and you want to have sex with your partner. So yeah, a lot of premarital counseling. I think that's so important to talk about sex, open relationships, infidelity, just all the conversations that I don't know we necessarily have had when it comes to premarital work.
Yeah, I don't think that a lot of times it is, though those conversations are had, even like talking about like what's your thoughts on like religion, like who's going to take if you decide to have kids, like and if you decide to have kids, like that's another conversation. Who's going to be taking the kids if you decide to be religious to the religious activity? Both of you, one of you, like who is it going to be? Like all these little tiny details, or who's responsible for mowing the lawn, and who's responsible for the dishes? Like, how are you dividing the household labor? Um, and it's kind of, there's a lot of things that go into that, like what we've heard through society, what we've seen growing up, our own opinions about it, and all of those things, and talking about them ahead of time don't necessarily happen because people are like, they're in love and they want to get married, and it's, that's great. But there's all these other conversations that sometimes have to happen. And you were talking about like the financial cost of divorce, but there's also an emotional cost of divorce. Like thinking about like how emotional it is to go through a divorce. Like it's a lot. So it's a good investment to help prevent some of that emotional cost that might come down the line with the divorce.
Right. Emotional. Yeah. It's a grief and loss. Like you lose somebody that's still living and they're not in your life anymore, potentially. Or like, who knows what that looks like in the future? Maybe they do come back and you work things out or whatever. It's just interesting to see like how all these different things work out. And like divorce is something that I've seen from different folks throughout time. And I'll ask people like, well, did they go to couples therapy to try to do discernment counseling? Like that's another type of couples therapy, like discerning whether or not should we get divorced, right? Or discerning like, can we make this work? Like we maybe never had that premarital work, but what do we have to do to make our marriage work, or to make our relationship better, to make it how it used to be? And then I hear sometimes people will get divorced and then they'll be best friends and then they'll be like, oh, we really should have gone to counseling. And I'm just like, why? Why did you do that? Oh, so I'm just like, obviously I've got a bias with counseling for some reason. I don't know why. But literally I'm just like, it could help so many people. And I think generationally too, like I think that's something that might be super different. Like I hear it all the time,
I
like
think
we're
it's
old school,
changing.
we don't go to counseling, we don't need it, or I'm good. And it's like, I think if everybody needs a doctor, everybody needs a therapist, if not more
Exactly.
than one. Same
Yeah.
thing. Hmm.
No, yeah, I agree. I mean, we act like, mental health is just like an add-on. It would be nice to go to therapy, but it's not considered that with our physical health. Like with our physical health, it's expected that we go and get an annual checkup. It's expected that we take care of our physical health. But with mental health, it seems like it's kind of like an afterthought. But
Hmm.
I think you're right that the way that people are viewing mental health counseling and counseling in general is changing. That people, the younger generation, seem like they definitely are on board and saying like, yes, I'm going to take care of my mental health. I'm going to do this preventatively, or I'm just noticing the start and I want to really tackle this issue before it gets out of hand. Um, so I've noticed that there's a lot more younger folks who are on board with counseling and even just taking care of their mental health in general.
Absolutely. It's interesting to hear like the change of different generations for sure. And it's kind of like with mental health, there's so much, like even today, like we haven't even gotten to this part yet, but there's so much between like physical and mental health, right? And sex. Boom, that gets thrown in there too. Like you might go to a doctor and be like, why can't I have an erection? Are you eating like shit? Are you smoking? Are you treating your body well? Are you drinking enough water? Are you taking proper medications that you have, right? Like, what is going on? And so there's so many different things too. And it can be like not only for that, but just being able to take care of your body takes care of your mind, and vice versa. Taking care of your mind takes care of your body. And part of your body and part of yourself and part of your soul is your sexuality. And so there's kind of this balance of like, okay, I may be experiencing genital pelvic pain or something like that, but I'm going to go to a doctor for it. I'm not going to go talk to a therapist about it because what do they know? It's like, huh, you'd be surprised. And so it's kind of like we need to have both of these people here. Like we really have to tag team some of this work. And it's kind of like if you've never been to therapy or counseling before, it's like sex therapy really gets into a lot of that stuff, just mental health wise. And there's so many components that just connect so much with it too.
Yes. Well, and kind of was thinking about this. So
Hmm.
I'll say like a wellness thing or something that we generally take care of, or if we don't take care of it, it has issues. And then you think of like different things that can pop up related to sex. And I can think of different things that pop up related to like our bodies and mental health. Sound good?
Yep.
Okay, so not drinking enough water. You've already mentioned this sex-wise. So what else can it do sex-wise for any
Okay.
gender?
Yeah, so literally not drinking enough water. If you're eating like shit, your body is just going to be full of carbohydrates. And it's like, okay, you may actually have a spike and whatever and be like, all right, I could go right now for sex. But then you're going to feel so fatigued, so full from like eating all this shitty food, right? There could be other stuff going on like in your body as well, like that could be a stress response to something if you're eating unhealthy. And if you're stressed, are you going to want to have sex? And if you're going to eat a lot of food, do you really want to go like have sex with your partner while you feel like bloated and like shit? And then essentially, there's just so much with nutrition that ties into it as well. Like being able to balance things out, like caffeine intake, absolutely, that could lead to like all this anxiety and all these things going on and go, 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 go. And then essentially, like you crash. And so it's kind of like, well, if I put sex on the calendar tonight with my partner and I crash, they're kind of going to be pissed at me that I had like 7 cups of coffee today and I wasn't balancing out the water. And so there's a lot nutrition wise too. Like there are so many different foods, natural foods that you can eat to literally like pump up your libido and like get those aphrodisiac feelings going and just like feel on top of your sex game and everything, right? But if you're constantly eating like shit, if you're feeling like, okay, I got some extra like COVID weight, I know I do, right? Like you may not
Everybody
feel
does.
sexy, right? Right? Like you may not feel as good about yourself and your body. You
Mhm.
may feel more fatigued. And just even with the pandemic, you're definitely going to feel more fatigued too. And so when we're treating ourselves, when we're not showing up as the best for ourselves, be it sexually, mentally, physically, that's going to be super difficult to be able to show up for our partners, ourselves, like just overall when we want to have sex. Like it's not going to work. And then when it doesn't work, then there might be problems that are happening. Like you might experience some different types of depression and anxiety with that, right? And then sexual functioning goes out of whack. You could also have dehydration where literally like your body isn't able to basically like your body is not able to achieve an erection or your body is not able to um, be hydrated enough where you might be flushed in the face and then that's all you can focus on and then like you can't focus on anything else and it's not like the good hot and sweaty kind of like we're fucking sex. It's like I gotta stop this doesn't feel good, like I need to go take care of me, like I might be overheating, right? There's so many things that can come into it. And one of the things too, I think that is super important when people say that, like, okay, when I am taking care of my body, when I feel good, when I'm eating healthy, when I'm balancing everything out, right, pretty evenly, right, like keeping those cheat meals, those cheat days in mind, whatever, um, you actually feel more satisfaction, more sensation. There's more blood flowing in the body, which we love that. More blood flow, more sexual satisfaction, pleasure, genital stimulation, boom. Like it's off the charts then. And if we do things to prevent that blood flow, it's gonna make our sexual libido lower. Like we're not gonna be as aroused. We're not going to feel as desired. We're maybe there's spontaneous arousal that might come and go a little bit, yeah, but that's not going to be as maybe consistent as you might want it to be. So a lot. I just like went on a tangent right there too. I gotta have
Yeah,
some water.
I was gonna say that and I think that when someone has like they're not drinking enough water, they're not taking care of their nutrition, then they have like a not a great sexual experience. I think that that's when their anxiety kicks in, and not drinking enough water can cause your anxiety to spike anyway. So they have a not great sexual experience, and then they have a lot of anxiety about thinking that it's them, there's something wrong with them, there's something wrong with the relationship, and it really it's like just take care of your basic needs, like drink, make sure you have enough water, eat healthy, get some exercise, like don't smoke, like trying those things first will probably do a lot to help with the issue. And then if it still happens, then maybe explore these other potential causes. But take care of the fixes first and easily. Like those are drink water, that's an easy fix. It helps your anxiety. Um, and I think smoking, if that really, it seems like smoking at the beginning helps to reduce anxiety. Like it's stress relieving to get that first hit of nicotine. But then after that, not so much, right? Is that
Yeah,
what
and
you
you
said as
feel like
well?
shit after a while,
Yeah.
and then you just like chain smoke, and then literally like, I'm sorry y'all, but like I don't want to suck my partner's genitals, like if they've been like smoking all day, like it just doesn't taste that great, right? And that's just something like smoking, like bless all the people out there in the world that have ever quit smoking, because oh
Yeah.
my gosh, I can't imagine. It just sounds fucking awful, right? Like that's really, really, really hard. And there's also things where it's kind of like, well, what's harder again too? Because if you're smoking, you could have some lung problems, you could have cancer that could lead to more and more problems too physically, which is probably going to lead to more and more problems mentally, which is probably going to lead to more and more problems sexually. Like it's all connected together, and so it makes it really tough and difficult for sure. And with sex therapy specifically, oh, I think the statistic off the top of my head, don't quote me, y'all. I believe 30% of sexual concerns are medical, 70 mental.
And do you
Just
feel like it comes down to like body image and anxiety? Like, is those like the mental really the two biggest things, or are there other things? Like, I think depression would probably be in there too. But
yeah.
what other things would be kind of on the mental health side if someone is experiencing like sexual
Yeah.
difficulties? 70%.
Yeah, it's definitely depression. So like sometimes getting a thyroid check is really important. Depression can be a huge one. Anxiety, absolutely. And it can also be just even different types of, so depression, anxiety, different work related stressors, past messages from your partner, right? Like an example could be like one partner putting so much pressure on orgasm and being like, well, did you come? Did I do it? Did I make you come? And then that person feeling like they have to fake it because they think that's what sex is all about. And sex is not for orgasm. Sex is for satisfaction. Orgasm lasts like maybe 8 to 10 seconds, and if you can have like two or three or multiple, like awesome, you do you all day. That's great. And it's also like it's about the content, the
Yeah.
context, and the experience of it too. So there
And
can be a lot of
the
different.
connection within the relationship.
Yes, yes. So there can be so many different things. So there is a lot of anxiety, depression, but there's also just like the general work-life balance, stress. Like, is this person a CEO of the company? Did this person get a promotion? Is this person really like working four jobs when they're only one person and they're like having to do all these different things? So it's kind of like, well, how can I be horny at the end of the day when that happens? Like,
They're
and then
exhausted.
burnout, right? Like that's a big one connected to it as well. So there's a lot with the mental
I'm
health side.
sure like sleep also plays a big, I mean, it's a huge factor with mental health too. Like if you don't get enough sleep, you're more likely to do depressed, you're more likely to have anxiety, and then vice versa, like depression, anxiety, PTSD, they all affect sleep as well. So it's kind of like this cycle people get into. But I don't know, like I don't know. Like you're the expert on sex, so does sleep affect sex if someone's not getting enough sleep?
Here's the thing. So thinking about it, just taking it one step back further, sleep affects our mental health, right?
Well,
I didn't get good sleep last night. probably, I'm probably, maybe when I get a little sleepy, I get a little like laughy, right? But then there's so much time, then you get more irritable, you get more crabby, you feel more stressed, then you feel more tired, and then you feel more fatigued. So then where is my sexual libido? It's probably like down low. So like, yeah, if we don't get enough sleep, are we really going to be in the mood, for sex? Probably not. So it can absolutely influence that. And then that definitely can tie into the depression and the anxiety aspect of it too. And it's kind of like even when we don't get enough sleep and we literally just can only do like maybe three things that day, right? And just focus on those three things, that can just be your best for that day. Sometimes that's enough. And sometimes sex, like maybe that's going to be on another day when you feel like, all right, I planned a whole sex day for self care. I'm taking the day off. So did my partner. We're going to be in bed all day. We can literally take naps in between and have sex multiple times, right? Like, that's something that I'll talk to clients about too. Like, even when planning like self care days, do you ever plan like sexual self care days and incorporate sleep into that? And some of them are like, oh my God, yes, like we do that. I haven't done that in forever. And some of them are like, what do you mean? I'm like,
you
it
can
would be
do that.
really cool.
You
Yeah.
can
I'm like,
be yourself
what
and
would you
do
think?
what you want.
Right. Like, what would you
Yeah.
think about that? So, yeah, it definitely ties in. So, that's where it ties back to the mental piece of it is the sleep, which can definitely affect sex. Absolutely.
Yes, definitely.
Hmm.
Oh gosh, I feel like we've talked about so much. I don't know what time. So it's like
Yeah.
1:41. So I know we both have our schedules are packed after this, so I want to make sure that we're mindful of the time. But I loved talking to you and meeting you and knowing you through Instagram. So I'm just so thankful that we got a chance to talk, and I've got more information than I know, and hopefully people have learned something from
Mhm.
this meeting and the conversation. That's what I love about these lives is the conversation and being able to connect with other people.
Yeah, that's what makes it so much fun. Hey, Davina. Hey, Tamika. I see you guys. Or I see y'all. My bad, y'all. Uh, but yes, I agree. I think these lives are super important for community and just being able to connect as therapists and just open up this conversation more. I love it. And I'm so glad I was able to connect with you too, Melissa, and we were able to do this live. And we can definitely do it again if you want to. We can talk about
Yes.
whatever. It doesn't have to be about sex. It can, but it doesn't have to be. It can be about anything and everything.
Yes. No, I think we talked about like maybe scheduling another one for about being like, because I'm in my first 6 months of my private practice and
Yeah,
you're in your first 6 months to a year of your private practice. And that would be
yeah.
kind of a cool conversation to have in case anyone is thinking about private practice at some point, they can at least know from our experiences what it's been like.
How not to fuck up, because I've made some fuck up mistakes. And I would hate for other people to not fuck up. Or, yeah, I would not want people to make those same mistakes or anything like that. But let's definitely do that. Do you want to give your Instagram handle on here one more time so people can go follow you?
It's at Body and Mindfully Healthy.
Okay, perfect. And sex therapist Jackie, thank you for doing this live with me. Thank you for everybody joining. Tamika will be reaching out to you to be a part of that live. You actually came to mine. So we were talking. So we will do that. This live will be shared later today. So everybody stay tuned, stay shameless. Final words to you, Melissa.
Just thanks for being here and being a part of this. I appreciate it.
Mm-hmm. Take care, everyone. Bye.